first clinical partner was an opioid treatment program here in Seattle. And I very clearly remember the first time I went down and visited the clinic. And there was a line of people going down the block waiting to get their methadone. It was one small snapshot of just the incredible suffering that we have from behavioral health problems of all kinds. And both from my training as a clinical psychologist, as well as from personal experience and family and friends, I know that therapy, counseling, all of the various ways that we can talk with people that can be healing. Therapy can be so effective and so powerful. And at the same time, it is largely hidden. It is a bit of a black box. For many years, I was a professor in the psychiatry department at the University of Washington. And one very common call was from friends, from colleagues, from family members, can you help me find a good therapist? That is not how we are going to solve behavioral health care problems. We can't rely on the networks and who you know to locate high quality therapy. There has got to be a better solution. The other thing is, if that is the solution, who doesn't have access to that? It's going to be underserved populations. It's going to be immigrants. It's going to be poor people who don't have the resources to pay and don't have those connections. That is not acceptable. Who you know and what you can pay for is just not right. That is not the solution for effective behavioral health care. High quality behavioral health care should be a basic right. It should be something that all of us can access. And so even though Lyssn is an AI company, it is really rooted in that foundation. There are so many other ideas that have been thrown at us of what we could do with our AI that analyzes conversations and provides feedback. But we are so committed to figuring out how we can develop AI to address the real world problems of mental illness, of addiction, of suicide, of broken families that we see in the child welfare system. And that is really what drives us, what gets me up in the morning.